Hello, viewers, and welcome to My Startup TV. We are having a very special guest on our show, Founder Talk, today. Why I say it's special is because after pandemic, after lockdown, as we all know, the pandemic is not yet over. The cases are still, COVID cases are still there, and it is still numbers are still rising. But as we have started coming out of our house, things have started going from online to offline. With that, also major concern has come over our health, how to be fit, how to take care of ourselves. Also, different kind of health insurances that we should have, and foremost, keeping ourselves healthy. Now, being an adult, it is much more easier for us. But when it comes to children or school going children, how can they take care of themselves or their health, or how schools can help them to be fit and take care of their health? Today, Sushant Sharma, founder of Digilooks Healthcare, would tell us all about it. Hello and welcome, Sushant.
Hi, Sujata. It is pleasure being on the show, and thank you very much for calling ourselves. Thank you.
Thank you so much for your time and talking to us. First, I would like to start with, how did you come up with the concept of Digilooks?
Sure. So, Sujata, I was studying in London doing my MBA, and there in National Health Services, a lot of emphasis is giving on healthcare of the students, and there are digital records which are maintained of the students, and likewise there are a lot of opportunities which are related to healthcare. So I found that I did a thesis on that at that point, a particular point of time, and when I came back to India, I found out that there is nothing like that happening in the schools. The best thing which school could get is closest nursing home or a hospital who can come over, do a random health check for the namesake, and get the data of the parents. So that is the thing which was happening. So I came back, I started my own preschool chain, had 3 preschools, but I always had this notion in my mind that I needed to do something related to healthcare of the students. And what I did was in 2017, when I saw that there is a lot of gap in this sector, and this needs to be addressed. So I sold off all my schools back and invested that money opening Digilooks Healthcare, and here we are today, providing healthcare services, healthcare programs to the schools, whereby today schools have got a lot of compliances to follow in terms of national education policy, CBSE and other education boards. And what we do is we provide them a single window solution in terms of, they need to conduct health checks, they need to do online counseling, offline counseling of the mental counseling of the students, they need to provide psychologists, they need to do have doctors, right insurance partners. So we provide a digital as well as an offline platform where anything and everything related to healthcare of students are catered.
Right. So how many schools are you associated with? How many schools are working with you? Is it only private, or you are also catering to government schools?
So this is a very good question, because just now government has initiated it for their Kendriya Vidyalayas and other schools in Delhi government. But to start with, to answer your question, yes, we are right now working in private. And as far as territories are concerned, we are working in Jammu Kashmir, Punjab, Haryana, Delhi NCR, UP, Kathmandu, and the essence is we are present in more than 50 schools. Should be reaching roughly 100 schools in this year. The essence is our technology. So we not only focus on conducting the health checks, we also focus doing it rightly, what is required during the preventive checks in each child. So if I may say that we conduct roughly, we check roughly 55 parameters of each child in general, ENT, dental, vision, vitals, and then put that data onto our cloud and get the data analytics rolling and give that analytics back to parents. So we have a vision, we have a mission to follow, whereby we want to make our children fit, healthy, And as you rightly said, post-COVID, it is the need of the hour today to make our children healthy.
Right, right. Now that you're talking about collecting, doing these health checkups, collecting the data, and also these data would be provided to the parents of the children. Now, I
Absolutely.
remember when these kind of checkups used to happen in our school, they would give a card, and the most what my parents would do, or even my classmates' parents would be doing is, oh, you have lack of this vitamin, or okay, this is plus and this
Yeah.
is minus. That's
Yeah.
it. And
Yeah.
in India, we have remedy for everything in our kitchen. So how do you make sure that once the parents get hold of these tests, these data in their hand, they make better use of it and they go to the right person, the right doctor, hospital, or diagnosis center, and get the right remedy for their children?
Sure. So actually, these were the concerns when we started the company. These were the concerns, and as you rightly pointed out, when you studied, when I studied, these were the concerns which we were following. So what we did was, now we have two aspects to it. Once a health checkup gets conducted of each child, we are, when I say more than 55 parameters, let me break it down to something like a dental checkup. In dental checkup, we even check the tooth number of a child. So to a parent, we tell them that this is the tooth number which needs to be, rectified, and you need to go and visit a dentist. So after doing that, we have two parameters to it. One is we have our own app on Android and iOS Play Stores, which parents can download. After conducting the health camp, there's a e-health card which is there, and parents can directly, contact the doctor from there, take their, online consultation, and go ahead with that. Moreover, we have tie-ups with good number of hospitals in the close vicinity of the parents, where they can go visit and take an appointment through our platform, go and take discounts, and at the same time make their children, healthy in terms of the deficiencies, in terms of all the unhealthy things which are there. So let me give you one example. Once we do a health checkup of each child, there's a BMI which gets calculated. After the BMI gets calculated, accordingly, automatically a health diet plan of each child gets marked onto our mobile app. So this is how we are trying to make our children healthy, and parents are in continuous touch through that mobile app.
Right. So it means that your technology is able to customize as per the child's health report, and it is able to
Absolutely.
give solutions to the parents
Absolutely.
for that.
Absolutely. Yeah, so idea is that only. So the vision of the company is we should provide a unified healthcare platform to the parents, where they need not to go anywhere else searching for the right doctor, for the right partner. So Sujata, you need to understand today that we are in tier 1 cities like Delhi and Mumbai and other areas, you would be able to find a good GP or a good doctor quite easily. But when you go to cities which are tier 2, 3, 4, they're finding out a right practitioner, right doctor is a great concern. And pediatrician, taking it to that pediatrician, taking time is a cumbersome affair. So what we do is we provide them technology, we provide them a platform where they can go, interact, have consultations, and go to the next step after the preventive health check.
Right, right. Sushant, how are these schools collaborating with you? Is there fees or subscription model? How is it?
Sure. So we have a subscription model for the school. So I tell my schools as well as to my sales staff that every school needs a customized sales plan. There is no school which will take the similar sort of a package which we have given to an earlier DPS or might be any other school. So when I say that, our packages start from somewhere 15 rupees a month per student. That's nothing. So when you talk
Right.
about rupees and you are getting such a holistic health checkup and mental counseling of the student, seminars and stuff like that in the school guys also gets motivated. Today when you go to school, we pitch ourselves that we are providing these number of services, and then you can customize yourself in terms of the services which are required. School jump off, they say that Sushant, we want everything, you just tell us. Because post COVID today, parents are ready to pay, children need healthcare support, and school need a vendor who can give a one-stop solution of everything. There has to be a single platform.
Right. You are saying 15 rupees per child. Is it for tier 2 cities, or is it also for our metropolitan cities?
So our package starts from 15 rupees. It can be anywhere. And then it goes, up to 35, 40, 45 rupees, depending upon the services which you opt for. For example, if there is a school who want to have a full-time doctor, then, it adds, if you want a complete infirmary, so you want medicines, you want, anything and everything can be customized as per the need of the school. But the whole agenda is we tell schools that today there has to be a start from somewhere. And once you take our services, then you are in a better position to tell parents also that you are in the safe hands, your children are in the safe hands as far as healthcare is concerned.
Right. So apart from, the monetary aspect, also when we are talking about doing checkups in schools, or especially mental health counseling or things like that, have you faced any kind of barrier or a challenge from the parents' side that why do we need this in school?
So it's an irony, Sujata. Let me tell you that today parents want somebody to counsel their children, because what is happening is today parents have got a lot of things to say to their children, and after a certain age, which is not even adolescent, children stop listening to parents, because there is an age when you need to be you need to be a friend, and once you cross that age and you don't become a friend, then there is a problem which starts aggregating. The other problem is children, most of the times what we have seen is the problem arises at home. So if parents are fighting, if you are not good with the nanu dadu, if say for example we are talking about bullying, or we are talking about not saying wrong, but koi phone aa gaya और पापा ने कह दिया बेटा 1 मिनट फोन उठा के बोल देना मैं यहाँ नहीं हूँ, तो क्या हुआ? What we have done is we have put something in the mind of the children कि भाई आप झूठ बोल सकते हो, ऐसी बात नहीं है. It is for your convenience. आप अपनी convenience से झूठ बोल सकते हो. तो वो हम लोग हटाने की कोशिश करते हैं. We have got seminars on adolescence. So today, leave tier 1 and tier 2, tier 3, cities, mothers are not speaking with their, young daughters, not telling them what is their need to be, addressed during adolescence age. So what we do is we take that mission and we have different topics under seminars like adolescence, cyberbullying, safe touch, unsafe touch for the junior kids. And there are many topics which have been guided by school to us.
Right. So you are doing these workshops and seminars, and are parents also welcome in these workshops, or is it only for the school children and the teachers?
So Sujata, what we do is once we sit with the school and finalize these workshops, we categorically today have a complete agenda where the workshops are for children, for students, primary, secondary, senior secondary, for teachers, and for parents. So I would not take the name of a school, and a very, very reputed school of Ghaziabad. What they did was they had their mothers and daughters sitting together in an adolescence workshop. And while we finished that workshop, it was tears in the eyes of everybody. So what I want to say is today there has to be workshops where parents and children should be standing and sitting together, holding their arms, and might be a platform will provide them a conversation where they can converse among themselves कि नहीं मैं ये पूछना चाहती हूँ मम्मा आगे चल के would you be my friend to tell me, because आज की डेट में सबसे बड़ी प्रॉब्लम क्या है, आपके फ्रेंड्स आपके मेंटर्स बन जाते हैं जिनको खुद ही नहीं पता कि इस सिचुएशन से डील कैसे करना है, and the last you end up going back to your parents when you know the things are not in your control.
We were talking about these workshops and all these. So जैसे हमने बात की, Ghaziabad is still in a par with places like Delhi and Gurgaon. How do you explain the need of such workshops? Because as I said, Ghaziabad is still not in that league of Delhi and Gurgaon or Mumbai or Hyderabad, where parents are much more informed or aware of what is the need. And just like Ghaziabad, there are many cities and nooks and corners in India, because India is a huge country. So how do you convince the schools and parents that this is the need of the hour?
Sure. So what we do exactly is we go to schools, and schools today, the principals who are sitting on the top, management, as well as the teachers who are around the principal and guiding principal about what are the needs of the children. They have a holistic idea that we need seminars on these topics. There are certain topics which school also think कि भाई बाहर की कोई कंपनी आके बताएगी तो पेरेंट्स और चिल्ड्रन दोनों अच्छे से सुनेंगे. तो आज की डेट में I want to take you back to your own school days. Every school at that point of time also had counselors who used to counsel the students, but most of the students were not going to those counselors because they feel कि भाई मैंने अगर इनको बता दिया तो प्रिंसिपल को पता चल जाएगा, मम्मी पापा को पता चल जाएगा, शाम को डांट पड़ेगी. एंड they were in a zone कि नहीं भाई मुझे बताना नहीं है, इससे बढ़िया तो मैं अपने फ्रेंड से पूछ लेता हूँ या किसी उसके मम्मी पापा से पूछ लेता हूँ. So what we do is we tell school that being an outsider, parents as well as children tend to open up more. They tend to tell us कि उनकी क्या problems हैं, वो क्या सिचुएशन फेस कर रहे हैं, एंड वी टेल देम एंड रेमेडिफाई देम. और बाद में जाके हम स्कूल को जरूर बताते हैं कि आपके इस बच्चे के अंदर ये प्रॉब्लम है, एंड देन वी हैव अ कंप्लीट बैक एंड प्लेटफॉर्म जिसके ऊपर एक बच्चे का हेल्थ चेकअप और मेंटल काउंसलिंग या सेमिनार के दौरान जो प्रॉब्लम्स हुई है और एनी अदर थिंग व्हिच हैज हैपेंड, वी अपडेट एवरीथिंग ऑन टू आवर प्लेटफॉर्म. And school, after the seminar or after the counseling also can go onto that platform, check what has happened and, take the notes out of it. So that's one thing. Other thing is the schools which are in the remotest areas, if I start from say Jammu Kashmir, we are giving seminars there. We are, doing health checks there. We are the market leaders in Jammu Kashmir today. You drop down from there, come down to Haryana, Sonipat, Panipat, then to Delhi NCR, Meerut. You go to anywhere. So today there is a need for these services. And during pandemic, 2 years, children were sitting in their shell, and in a home, and in their own shell, they didn't knew what to interact, whom to interact. And most of the children have passed their 12th also before they have not come to the school. So there are a lot of problems with these students are facing today, which we are trying to address.
Right. And as you said, due to pandemic, we had the lockdown, and due to lockdown, our kids were sitting at home, our children were sitting at home, and there was a lack of communication, especially the toddlers who are just beginning with their schooling. And we see a lot of lack of communication skills in them. So are you also working on that front with the kids?
So what we do exactly is if school comes back to us and tells us that we need some kind of counseling for these students in terms of, executing their speech therapies or something like that, we do work in that area. We do work in special educators area. As far as counseling is concerned, we are also into doing one-to-one counseling of the students or group counseling of the students. So as far as mental counseling is concerned, we are trying to touch almost all the aspects. And we are always in a position where we are learning from schools also. So when you go to school, there are almost different sort of what I would say is approach which you see in tier 2 or might be in tier 3, because the psyche of parents are different in every area, and the kind of parent, the kind they interact with their children is almost different in every area. But yes, we have mastered almost the approach what to be taken in among parents and school. And yes, once we go to the school and tell them about it, school hands-on take our service in terms of healthcare.
Right. So because you will be needing a lot of services from counselors, from doctors, from physicians. So do you have your partnered hospitals and doctor services on board in your on board in your system, or is it how does it work?
Yes, so let me tell you. So basically what we do is we tie up with the hospitals, not for the health camp, but after the health camp, if parents wants to go and get a consultation for their children, they can go to these many hospitals. But the core of the company says, so the SOP of the company says that we will hire doctors onto our own platform, train them, and then tell them to go and conduct the health camp. So idea is we don't go to a hospital, tie up with a hospital, tell them to do a health checkup on our behalf. So this, they can also do. So what is the value add that I am adding? Value add is I have a complete dedicated team of doctors, nursing staff, back-end office guy who are going as a team there. We have a complete list of everything which is getting checked. And at the same time, we have our own software on which the entire data is fed. We have cloud at the back end, which is, doing the complete artificial intelligence work and stuff like that. So my core is that we hire team onto our own platform. We have our own team conducting the health checkup, whether it is Jammu, Kashmir or Delhi NCR.
So if parents want to connect with you directly and take your services directly, then can they come directly to the app, or is always has to be via a school administration?
So Sujata, there are two ways to it. One is if they want to download the app and keep the medical records, share it with their doctors, take diet plans and all these things, they can do it on the app. That's they need not to have our involvement in it. They can directly go onto Play Store, download and do that. But as far as health checkup is concerned, the kind of costing which I was talking about can only come through numbers. And what I would rather suggest to parents, say for example, if there is a parent who thinks that we are doing something good for the society and for the children, they can go back to their school and tell them that why don't you talk to this startup? They are already doing something good in the field of healthcare for the students, and we as a parent would love to have that for our students. So I think that can be a sort of a agenda which can go from parent side towards school.
Right. And are you going to take on these services and go to colleges and universities or working professionals, offices, atmosphere like that?
Absolutely. So that's the vision. We should be going and reaching out to universities. We should be going to offices in the next phase. Maybe in a year and a half from now. But currently, our core focus is on students in schools, because that's a very large chunk who needs specialized services.
Right. Right.
Yeah.
And apart from that, what are your plans for funding? Are you trying to raise any funding, or are you bootstrapping? How is it working?
So we have already raised our first round of funds from from 5 angel investors, and that happened in 2019. That was our first round in the company. Unfortunately, 2020 everything got stuck for 2 years due to pandemic. But right now, the kind of which when we go to investors or when we are going to these lobbies, they are hand holding us like anything. And the best part is Amity. So Amity Incubation, I just want to thank Ojaswi and Vijay, who has helped us a lot. So Amity is one of the companies who has equity who has taken equity from our company. And the best part is the kind of mentoring they give. They also provide you incubation support. They also provide you space and other things. That's great. As far as funding is concerned, yes, we are looking forward to have our next round of funding within this year, and shall be taking one post July, because till July end or August we are totally engulfed in serving our clients. And from August onwards, I think I would be in a position to go back to investors, telling them that, okay, now is the right time to put your funds in the company. But yes, we
And
would be.
what would be the aim? How would you utilize the funds?
So the funds will be utilized to grow more territories, for hiring sales staff. Then it would be to have better health checkup experience for our students. We would like to include few more technologies in it. And as far as backend is concerned, we would like to consolidate ourselves in terms of AI ML. And next thing which we are bringing is blockchain into our medical records. So we would love to bring all these services under one roof for the students. And for that we need funds. So we would be reaching out to investors for doing that.
Wonderful, wonderful talking to you, Sushant. Thank you so much for coming on our show, and all the very best.
Thank you.
All the very best for your second round of funding, and hope to see you reach many more schools and colleges.
Thank you very much, and I am very hopeful once I receive our second round of funds, should be here to give you another interview.
Definitely, definitely. Thank you so much for being on our show.
Thank you. It was pleasure talking. Thank you very much.